So, we have here a totally different
S'il vous plaît.
kind of patient. This is a 50 years old patient. She never had been done any kind of treatment on her face. In my opinion, in my personal experience, it's a difficult patient because we have a lot of fat tissue in this area, the skin laxity and a little bit of sagging skin here. So it's not, in my opinion, it's not the perfect patient to treat with HA filler, but I will show you if you only have as a weapon the fillers with the hyaluronic acid, I will show you how you can use these products in order to improve this kind of situation. The topic here is to improve the marionette lines here, but I will take advantage of this situation to show you some techniques in order to obtain a good result. So I will talk 1 minute and then I will start because I have a lot of work to do here. So first thing, I will try to hide this depression here in order to obtain a better shape of the jawline here to hide this skin laxity. Then I will work in this area to expand this tissue, and then I will work in the perioral area in order to improve these wrinkles of the bark of the patient. You have two options here. You can work with the needle and you can work with the cannula. I am a cannula guy, so I will use a cannula. The depth of the cannula is a 22 gauge, and I have two sizes, the 50 and the 70 millimeters. I choose in this for the first injection the 50 millimeters. Okay, just to work here and here. Obviously, from this access point that I will perform, I can reshape the jawline, work on the marionette line, and also improve a little bit the nasolabial fold. But as if you want to improve very, very nice this kind of patient, you need to work absolutely in the lateral part of the face. But it's not the goal this time. Maybe I can do it off camera for you. And then I will use this access point to add a support of the loss of the tissue in this area to correct the tiny wrinkles of the barcode with the cannula. And in base of the needs, maybe I can use the needle, because this is why the numbing cream inside of the wrinkles, like a blanching technique. So I will start. So please, the patient, lie down. Okay. So I will use different products here. This time I will use the Filmed products, and the first product I will use is called the Universal. So as the name of the product is a universal product that is a very good balance of the 3 HA chains of the hyaluronic acid, with a very long chain and a part of free hyaluronic acid. Okay, so I will mount my cannula, and this is the access point. So please, here, and I will do my first access point here. Also, here is a dangerous zone. So for me, I like to work superficial in order to avoid complications and in order to maintain the results. because if you go deep, you need to use more product. Okay, a little bit pinch here, sorry, all right. Perfect. Okay. Now, I like to work bevel up in order to have the product in the superficial part, and just move very slowly. You see the cannula, so I am superficial here, a little bit of resistance, but it's normal because of the ligaments. And so finding technique, slowly injection, and my goal here is to hide. I'm trying to avoid the injections and the release of the product here because I don't want to increase the sagging in this area. Okay, now a little bit down. All right. So I am correcting what we call the pre-jowl area. Thank you. Don't touch the cannula, please. For this area, we are using more product because it's an area that we need a lot of product here. This syringe comes with 1.2 of HA. Okay, so 20% more than other syringe. So this 20% more could be very useful. Thank you so much. So I am seeing now how she is improving here, but I need a little bit of support. Okay, now I am moving here just to have a little bit support here. If you want to be safe, you need always to move yourself and your hand. Little bit of massage, and you will see immediately after how she improved this area, less sagging. Okay, so I will change product here now, and I will use the more soft product. It calls fine lines. Yeah, I will use it very superficial in order to improve the marinette line of this area. Yeah, the same camera. Yeah, that's great. Yep, is the access point. Okay, perfect. So. Now I will pinch in this area strategically in order to work here and here. Very superficial. Sorry. Then I will, right. No, I changed my mind. I will use another cannula because this, yeah, the 50. Okay. If you can open, please. All right. Okay, perfect. So, new cannula. Okay. So this product is 1 ml, different from the before, and I'm correcting the depressions of this area. Okay, you see, always in moving, immediately result. I can always also the corner of the lip. Okay, Perfect. Also a little bit of volume superficial in the nasolabial fold. It's a danger zone here, but if you are continually moving, is safer that release boluses in this area. Okay, so the trick is the slow injection and the continue moving. So I use here this the okay, no problem. Okay, I use here 2.2 mLs of hyaluronic acid. Okay, just in this part of the area. I will show you a partial result, please.
Yes,
side.
show us the result, Massimo.
Zoom out, please. Zoom out, and okay, it's nice than before. If you later, if you remember how she started, obviously we have a problem here. We cannot hide all, but she is already improved. Okay, perfect. So I will finish the treatment because I know we are a little bit late. So I will need another universal.
Sorry, there is a question, Dr. Vitale. Mic, please.
Yeah, perfect. Because I will work in this side. Okay, so I will open another universal with another 50. Yeah.
Micro, s'il vous plaît.
Alors, s'il vous plaît,
Thank
en faisant
you.
cette injection,
Perfect.
on a respecté l'espace entre
All
l'abat-jour et le support mentonnier. C'était exprès où il fallait toucher pour harmoniser l'ovale, plus ou moins la partie centrale.
Quelle partie postérieure?
Cette partie centrale. Donc, on avait laissé, on n'a pas touché l'espace entre le support mentonnier et l'abat-jour. Cet espace.
Si, c'est ce qui a été injecté. C'est
Non.
ce qui a été injecté.
Mais ici, ça reste un creux.
Sorry, Dr. Vitale,
Yeah.
did you can you describe the area you are injecting behind the chin, please? This area.
Can you repeat the question?
Sorry, can you describe this area behind the chin you are injecting?
Okay, this is you have a little bit of sagging skin here, so in my opinion here you need to work with other kind of procedures because you can improve the shape of the jawline and the chin, but you need to correct this area first. So in this area I am using hyaluronic acid in the superficial layer of the tissue just to hide the depression and to order to can say the word like a camouflage, you know, camouflaging the laxity of the skin. Okay, so I did one access point in the pre-jowl area and adding the volume in this part of the jawline. A little bit of product also in the chin area, but not deep, not in the bone.
Donc il injecte, il injecte dans la dépression. Dans la dépression, il injecte. Pas au niveau de l'abat-jour, mais dans la dépression. C'est ce qu'il vient de dire.
All right. And now I finish. So this area, compared with the first area that I treat in this patient, she has less sagging here. So the result is better in this area. So the fine lines here, please, with cannula, of course. Thank you. So we are right now at 3.4 ml did in this patient. All right. A little bit, a pinch here, sorry. All right. Thank you so much. Okay. And I perform the same thing here, just to hide the depressions and the marionette line, and I also correcting the depression of the barcode, restoring the volume loss. I am correcting the marionette lines, I am correcting the nasolabial fold, very superficial, always moving the cannula in order to avoid problems. Okay. Sorry, I know this hurt. And with this procedure, we are hiding also the shadows and the dark sides on the producing by the skin laxity. Okay? So right now, 4.4 ml of hyaluronic acid, and I will finish doing a needle technique, like blanching technique in the perioral area, because I already restored the volume with the cannula, and then I will.
Dr. Massimo, while you will finish your patients, we will collect some questions because we are running quite late, unfortunately.
Yeah. Okay.
So you won't mind about that, I'm sure.
5 minutes. Yeah, okay, then, no problem. Fine.
Any question from the audience? Any point you would like to deep?
Micro, s'il vous plaît.
Yes, for the smoker lines, can we, which is the best treatment for them? The universal will work with the cannula, or we need the blanching, or it depends on the maybe the depth of the lines?
Yeah, I understood good that you are asking what will be the best treatment on this patient.
No, not for this patient, because I don't see really the smoker lines on her. I just see, so if she had smoker lines, we will treat it with the same treatment, like with the cannula and with this kind of hyaluronic acid, or we should treat by blanching or by just needle?
Yeah, I will finish the treatment and I will answer you immediately after.
Yeah.
So because I remains less than 5 minutes, okay?
Okay, thank you.
Okay, so in this case, I will use a sharp needle, 30 gauge, and I will blanch these wrinkles here just to hide and restore a little bit of volume. Okay, very, very small amounts. It's a little bit painful. Sorry, I know. Sorry. Okay, this kind of product could be positioning in a superficial layer without any problem. If you see a little bit lump, it's not a problem because they will be distributed very, very well. It's a painful area, so we need to be very, very gentle. We need to apply the numbing cream. Okay. You can here do this technique with the blanching, or you can use the needle inside of the wrinkle from the top or from the bottom. Okay. Okay. So I think the patient has already suffered a lot. So I will finish and I will massage. Thank you. Little bit strong massage here is useful.
25 minutes.
Okay. So I finish the treatment and I use 4.5, let's say 4.5 ml of hyaluronic acid. Okay.
Okay, so show the result.
Yes,
show
please.
us the result, please.
Okay.
Very good.
This way. Okay. Perfect. I will
Okay,
take
great.
a picture and I will come with you.
Thank you, Dr. Vitale.
Yes, my question was about the smoker wrinkles. Which is the best treatment? Is it with the cannula to be much deeper, or with the blanching, or with the needle?
Yes. When you are treating this area, okay, you know that you have not only the fat tissue volume loss, but also the reabsorption of the bone. Okay, so the first thing here is to replace that volume loss. You can do it obviously with the hyaluronic acid, but if you are doing other procedures like working with the fat, you can also add like a lipofilling. Okay, the best way for me is the cannula, because you first you replace the volume loss, and that could be a very good idea to expand this tissue. And after, you can use your needle. Okay, you can use your needle to expand these wrinkles. In the past, I only did the second part, only doing inside the wrinkles, but I didn't taste so much. Then I realized that before I need a volume, just to push the tissue and replace the volume. And then I refine inside of the wrinkles. Also here, you need a very low G prime product, because you can has a projection of this area like a duck face. It's not good. So whichever product you want, but very low G prime. Okay? Yeah.
Great.
For the marionette line, should we go like from here or from here to sustain?
It's the same.
Sorry, we are really running out of time.
Perfect.
Dr. Vitale will be available in the coffee break to reply to all your questions until late at night. No, I'm joking.
Shall I wait here? I don't know.
No, you can have a seat here. It's my pleasure now to call Dr. Bennan, which will be the moderator for the next session.
Dr. Bennani
will help her.
Okay. So now we are passing of the second session for the lower face contouring. Right now we are focusing in a different area, and we will see different techniques in order to improve the shape of the face. Welcome, doctor. So we will use fillers, we will use threads, revitalizing threads. Yeah. Okay. So I don't know if the first speaker is ready. Oh, nice to meet you, doctor.
Nice to meet you.
Okay. So I will unplug the micro, and I will come back immediately. Okay.